Good morning. Today we are joined by Professor CHERUVU. The topic is surgery in the COVID pandemic period of 2020.
Good morning. Surgery in the COVID pandemic period is quite challenging for the hospitals, surgeons, nursing staff. In addition, it's quite worrying for patients to undergo surgery in these difficult times, as this is totally unprecedented.
Thank you. My first question, how should hospitals prepare to perform surgery during the COVID period?
Providing a safe surgical service is a challenge to the hospitals and the surgical teams. To provide a safe service, the theatre management has to take into consideration the turnaround time, and appropriate theatre allocation time is essential. Patients should have an informed consent of the complications and the risk in the COVID period. Theatre should have separate donning and doffing areas. The theatre nurses should be provided enough time for preparation and cleaning up of each case. The anaesthetists should have sufficient appropriate PPE and should extubate and intubate patients in isolation to avoid spread of infection. And finally, a dual consultant operating is ideal to reduce complications, and at the same time they should have effective PPE in the form of FF3 masks, visors and double gloving.
Thank you. Next question. How should hospitals prepare to reduce the risk of infection spread?
To reduce the spread of infection and provide a safe service, the hospital and surgical teams should have 1. Adequate resources in the form of PPE and adequate COVID testing facilities. 2. The hospital should be restructured into COVID-free green or safe zones, and 2. Also to COVID areas or the red zones. And 3. Appropriate triage of patients where all patients are COVID tested, and if a patient is asymptomatic and tests negative, should be managed in the green or the COVID-free zone. If the patient is asymptomatic and tests positive, should be isolated or quarantined. And on the other hand, if the patient is symptomatic and tests positive, should be managed in the red zone or the COVID areas of the hospital.
Thank you. Next question. Should operations be undertaken as open procedures or as laparoscopic procedures?
This is a hotly debated topic around the world, and although there is little evidence, open surgery was proposed initially. However, with increasing evidence, laparoscopic surgery is now accepted as safe and effective wherever it is appropriate to perform. The advantages are it reduces the length of hospital stay and avoids patient contact with the body fluids, blood products and organs for all the surgeons and the staff. For provision of safe laparoscopic surgery, it is now recommended that we use air seals to prevent air leak.
Yeah, we'll take a video of that. Carry on then. Yeah. And then this goes down? Yeah. Fixing the air seal. Okay. Air seal mode, please. Air seal mode. On the right. Air seal. Yeah.
Thank you. Going forward, do you have any recommendations or any particular concerns that you'd like to raise for surgery?
As a surgeon, I'm worried and have some concerns about how the future is going to be. For starters, there is a possibility of a second surge as seen in some countries, which can cause a delay in normalization. Number 2, as surgeons, we are already functioning differently, but with telephone clinics, virtual MDTs, virtual consultations, and virtual team meetings for patient care. And 3, I'm concerned about serious impact this has on trainees and surgical training, as the impact is likely to last at least a year, if not more. And health planners should look at it differently, as this can result in stagnation at the top and the bottom end of the ladder, thereby resulting in shortage of workforce in the longer term. This COVID pandemic 2020 has been difficult to all walks of life. We as clinicians and surgeons should rise to the challenges and adapt to the new social and professional norms, remembering to provide a safe and effective service to our patients.
Thank you very much.